Okay. Thank you. Appreciate it so much. Well, let me start by saying this is my first time I'm doing this presentation, so you guys got to bear with me a little bit. I think I'm going to start out by telling you my story just a little bit, and then we'll get into the slides. How about that? So again, it's Keith Taylor. Thank you so much, Dave. Appreciate you and what you guys are doing. So I was a business owner, had a fairly large manufacturing company in Salem, and 15 years ago, I had a stroke. And at the time, 15 years ago, the neurologists and all these docs and stuff that you go see thought that you had about a year, year and a half as good as it's going to get for you. And I struggled immensely. Couldn't talk. It was a painful experience. And excuse me if I get a little emotional, but I went in after a few months and went back to my company and we always had a round table of the four of us owners and moving the company forward, and I couldn't talk. I couldn't say what was on my mind, and here I was, the owner of this company, and tears would just flow down my face. Frankly, it was a really tough go. And so now in today's world, the neurologists and everybody knows that you can continue to grow. You can continue to learn and redevelop again. And so that's kind of the message that I want to send personally. I have my own company. It's called Strength After Stroke. And I started that because after going through some depression, I've never been a depressed person ever. And when I went through that, I was definitely depressed. And I finally got to the point where I was like, what is going on here? There's got to be a ton of us out here that need to know it's going to be okay. And so I built a program called the BASE program. I started Strength After Stroke, and the BASE program is belief, attitude, strength, and energy. And now I'm giving that to Stroke Awareness Oregon, which is who I'm representing today. I've known Stroke Awareness Oregon for quite a few years, and I love these guys. They're in Bend, and we're making a huge impact on the world. So enough about that. So stroke awareness and prevention. First of all, thanks to our founding sponsor, COHC, Central Oregon, to help us get this going. So about Stroke Awareness Oregon, and I am going to cheat and read because, like I said, it's my first time doing this. So SAO exists to minimize death and disability from stroke, support the best life possible for stroke warriors and loved ones. I'll tell you more about SAO pretty soon. The pillars of care. So C is collaboration. We collaborate with the medical businesses out there, the hospital. We do a lot of collaboration work and to get our mission out there. A is awareness. The Be Fast campaign, which you guys can see there's a lot of materials here. I would invite anybody, please come look at some of the materials when you're done. We have a book. We'll give you the book. We've got all kinds of stuff about stroke, and it's very important. So that's the Be Fast campaign. Recovery. So the recovery aspect, we have a lot of stroke survivor meetings and such, and when COVID came along, we had to shift a little bit. We weren't really going that strong yet, but we shifted, and now we do a bunch of internet-based stroke survivor meetings. I run 2 of those meetings a month that are our stroke warrior meetings, and we invite everybody all across the nation, and we have anywhere from 9 to 25 people do those every time, and a lot of them are from the East Coast, and we're making an impact on the world. I feel, of course, very strongly about that. We have peer-to-peer groups, which we go to the hospital. We meet with people one-on-one because a lot of people don't like the group settings, right? So we'll do one-on-ones with people, and we get certified. We certify people to talk. about that. A little more on the support groups. We have a men's group that we do. We have a caregiver group. Like today we're running a caregiver group for those people who aren't, who are the spouse or caregiver in any capacity to a stroke survivor, and they need somebody to talk to sometimes, because stroke survivors will get very internalized and think about themselves all the time, and sometimes the caregivers need somebody to talk to. And then we have a young person stroke survivor group, and that is run by Alicia, and it's for people who are 55 and less. So that's what that's about. All right, education, we do these just like this. We're doing education right now, and we do a lot of these kind of meetings to help people understand and have hope for recovery, frankly. I'm going to show you this video. I hope it works. And once we get started on that, I'm going to let that talk. It's about 7 minutes long, and then we'll go from there. If I can figure it out.
The Rotary Club of Greater Bend is pleased to sponsor the following video for Stroke Awareness Oregon. Our intention is to arm each of you with life-saving information about stroke causes and prevention, the importance of getting medical care if you think you're having a stroke, as well as opportunities available for those who have experienced a stroke. Thank you for joining us today.
Did you know that in the U.S. a stroke occurs every 40 seconds? It is estimated that 1 in 5 people in the U.S. will have a stroke in their lifetime, and 1 in 4 survivors will have a second stroke. As a result, stroke happens to be the leading cause of serious long-term disability in the U.S. Studies have noted that each year 10 to 15% of the approximately 800,000 people in the U.S. who have strokes are between the ages of 18 and 45. This increase is thought to be due to increased sedentary lifestyles, obesity, high blood pressure, diabetes, and drug use. The good news is that as much as 80% of strokes can be prevented through healthy lifestyle choices. So what exactly is a stroke? Some folks might refer to them as a brain attack, similar in mechanism to a heart attack. There are 2 distinct types of strokes, the most common being an ischemic stroke, in which a blood vessel in the brain becomes blocked due to a clot forming elsewhere in the body or narrowing of the blood vessels in the brain. When this occurs, a portion of the brain is deprived of oxygen and becomes damaged. It is estimated that every minute the brain is deprived of oxygen, 2 million brain cells are lost. A transient ischemic attack, otherwise known as a TIA, is considered a warning stroke and consists of transient neurological symptoms that resolve without any tissue injury. Even though the symptoms resolve on their own, this is considered a medical emergency, and prompt evaluation and treatment can reduce the risk of future stroke or TIA by at least 80%. The lesser common stroke is referred to as a hemorrhagic stroke, in which there is a bleed in the brain. This might result from ruptured small blood vessels, arteriovenous malformations, or rupture of an outpouching of a blood vessel called an aneurysm. The number 1 risk factor for both types of stroke is high blood pressure. Other common causes include high cholesterol, diabetes, atrial fibrillation, and sleep apnea. In addition to managing risk factors, the most important thing to reduce disability from stroke is to identify the symptoms quickly and get help. For this, we use the mnemonic B FAST. B stands for balance. Watch out for a sudden loss of balance or coordination. E stands for eyes. Note any vision loss in one or both eyes or double vision. F stands for face. Watch out for drooping on one side of the face. A stands for arms. Note any sudden weakness in an arm or leg. S stands for speech. Note any slurred speech or difficulty speaking or understanding words. T stands for time. Call 911 quickly if someone is experiencing any of these symptoms. As we say on the stroke service, time is brain. Other common signs of stroke include sudden severe headache with no known cause, sudden numbness of face, arm, or leg, and sudden loss of hearing on one side, or swallowing difficulties. Things that will be very important to document are when the person was last seen at their normal. You want to get to the hospital within a 3-hour window of symptom onset to increase likelihood of receiving life-saving medications and procedures. An ambulance will transport you to the closest stroke-certified hospital, and EMTs will do a stroke assessment so that they can communicate with the hospital team and prepare them for your arrival. You will bypass the ER waiting room and save time. Time is of the utmost importance. 2/3 of stroke survivors are disabled due to delayed care. Don't wait, just go. Once at the hospital, you might receive a thrombolytic such as TPA or TNK. These are often referred to as clot-busting medications. When given within 4.5 hours of symptom onset, these medications can restore blood flow to the affected area and decrease damage to the brain. Depending on the size of the stroke and the vessel involved, a thrombectomy may be performed as well to remove the blood clot from the vessel.
While suffering from a stroke can be a difficult life transition and present obstacles to daily routines, there is reason for hope. A team of specialized professionals can guide your recovery to regain function, independence, and purpose. As the brain heals, it relearns how to do basic activities and can rewire itself to learn new tasks. A good healthcare team and strong support can make a major impact for people of all types and severity of stroke return to a meaningful life. Stroke Awareness Oregon can help you connect to the right resources to make your road to recovery fulfilling and purposeful.
Recovery from stroke is going to be some of the toughest work you've ever done in your life. And not doing it alone is really important. Stroke Awareness Oregon was founded by a stroke warrior and local medical doctor to bring awareness to Oregon communities of the risks and signs of stroke, how to spot them, and what to do if you or someone you know is showing signs of a stroke. We do this through our Be Fast card distribution, Stroke 101 community presentations, and Stroke Hero training, which is an early prevention tool for 4th grade students, encouraging healthy lifestyle choices at an early age. Because as you've learned, strokes are 80% preventable. We at Stroke Awareness Oregon are here to help support you in your recovery journey back to a better quality of life after stroke.
Okay, so you heard a bunch of what it's all about, of course, through that video, but I'll just burn through these next few videos, and then I would love to get to some question and answer and talk about it if anybody has any questions. So it's the 5th leading cause of death in the U.S., 4th leading cause of death in Oregon. Greatest source of permanent disability worldwide. 1 in 5 people will have a stroke in their lifetime. Let me ask, who here knows somebody that had a stroke? Almost everybody here. I mean, it's a huge thing. Anyway, stroke stats, rates of strokes by demographics. People 65 or older, 1 in 3 women, highest in Black, Hispanic, Native, and Pacific Island Americans. Veterans, people who have suffered PTSD, 1 in 4 survivors will have a second stroke. The stroke, the age is coming way down. So more and more younger people are having strokes. I don't know if it's stress related or what it is, but we see that a lot. It's a brain attack. There's an ischemic stroke, which is a blocked blood vessel, and a hemorrhagic, which is ruptured blood vessel. Causes a stroke: high blood pressure, high cholesterol, diabetes, nicotine, atrial fibrillation, sleep apnea, TIAs that we just talked about a minute ago, and PTSD. AFib increases risk of stroke by 3 to 5 times. Sleep apnea is also a big one. Contributor, these are strokes for women: birth control, hormone replacement, migraines, pregnancy. I don't even know what preeclampsia is really, if I'm being honest, but, and chronic conditions. They are preventable, most of them. A lot of people who have strokes didn't see it coming, and it wasn't because they were out of shape or anything.
On sleep apnea,
Yes.
those numbers related to controlled or uncontrolled sleep apnea.
Are you asking if it's controlled or say that again?
The numbers that you were showing,
Ah,
is that related to uncontrolled or controlled sleep?
I'm sure it's uncontrolled. I'm sure it's uncontrolled. He asked, is the sleep apnea numbers that we were showing, were they controlled or uncontrolled? And I'm sure it's uncontrolled sleep apnea. I'm sure that when you go in, they're dealing with that. 8 pillars of stroke prevention: eat clean, get moving, avoid smoke and vape, prioritize your sleep, maintain healthy weight, celebrate in moderation, keep stress low, see a doctor. This card is on the table as well. I'm not going to go through it, but you guys understand keeping your blood pressure in good shape, right? Taking your blood pressure. Now, of course, it's so much easier. Who here has a blood pressure monitor at home? See, so it's getting more and more that way, and it's getting more expensive. That's a great thing. We got to stay on top of that. We have blood pressure test locations, which most of you won't need. How to identify a stroke. So we have our BFAST cards. I would invite everybody to take one. They're over by the book here. And you can put them on your fridge. You can put them anywhere so that people are aware, your spouses, whatever, children. Once they are aware, then they'll take you. So many stroke survivors will have a stroke, and then they'll argue with their family members to take them to the hospital. And we gotta get over that. We gotta go to the hospital when you're feeling something like you were telling me, where you're feeling off and your hand wasn't working correctly. Your wife made the right choice. Get you to the doctor and see what's going on. Even though that was a TIA, it could have been a lot more. And so you gotta stay on top of that, please. Balance loss, eyesight changes, facial drooping, arm weakness, and speech difficulties. Other signs: sudden dizziness, trouble walking, loss of balance, sudden severe headache with no known cause, numbness of the face, arm, or leg, confusion or trouble understanding other people, nausea or vomiting, and word salad when you're just not making any sense when you're talking to your spouse or whoever. It could be on a phone call, whatever. It is a medical emergency. You've got to call 911, and you got to go in right away. Time is of the essence. I don't, know what it says here, but time is of the essence, just like the video was showing you. The sooner you get in, the faster they can maybe run some testing, and they can do some things that will completely, I've seen people come out of the hospital completely not changed. And so it's very, very important to take it serious. So we do promote with AirMed Care as well. I've got a promo code, and there's cards here too. If you guys don't have it, you should consider that. So life after stroke: emotional, behavior, and cognitive changes are common. Screening for each is important. Rehabilitation therapies: you got physical, occupational, speech, cognitive, all these different things. Stroke communities and support groups, that's what I'm a huge part of. My BASE program deals with the things that I felt were important, because you can go to the physical therapist and you can get physical help, but what about the mental side of it? And that was where my passion led me to create the BASE program and and write the book and everything. Recovery programs, you know, SAO, Stroke Awareness Oregon, has many, and like I said, stroke support groups, a lot of different things. We have Just Say Yes to Life, which is the book right there. We're writing another book right now that is for caregivers as well. Education programs, this is Stroke 101, Stroke Heroes, which I would love you guys to look at the comic books if you got grandkids or anything, important for them to know. Be Fast, on and on. This is if you wanted to schedule another presentation. And there's a QR code. So basically that is it. I wanted to say thank you so much for having me here today. Dave, I really appreciate it very much. And I'd love to answer any questions if I can, and if there are any. So Dave, go ahead, and then.
The stroke you went through, walk us through that. You said, you know, you couldn't, did you ignore it and not get to the hospital? Or?
I did ignore it for a while. I was home alone when it happened. My wife went to work very early, and I was like, what the hell's going on? You know, and I ended up going back to bed. I never did this. We worked many hours, of course, as you guys are, most of you guys are business owners or know that. And I went back to bed, and I didn't wake up until she came home at 4 o'clock. And then she checked in my mouth and checked some things out, and I was doing kind of okay. And so she's like, well, let's check you in the morning. She left again early the next morning to go to work, and I was supposed to go to Seattle. I was a sales manager of our company, and so I got a phone call from my partner early in the morning, and I talking to him. He's like, "What the hell is wrong with you?" And that's when. And then he called my wife, and she came and took me to the hospital. So it was brutal. One thing I didn't tell you guys, you know, I was an owner of this company, and a year and a half later, after the neurologist told me that, they fired me, basically, paid me off and said, out you go. And it was a brutal experience. So. Yes, sir.
This is off the wall, but how did you happen to choose the fourth graders for your instruction?
You know, that's a great question. I don't know if I have the exact answer, but I will say this. We are, stroke is one of those things that until you have it, you don't know anything about it, it seems, right? Or your family member. And so we want to educate people on a younger basis so they are aware of what it is that's going on. And so that if something happens to either them or their folks or their grandparents or whatever, then the knowledge is there. And we want to start getting the knowledge out to the whole, you know, community and nation, frankly, about that. Does that make sense?
As I just wondered about the particular grade level, so.
Yeah, we made this comic book, and you guys, please, I invite you, please, to come up and do this, and I'd love to get some of the names of everybody here. I think there's about 20 of us, but this is a little comic book, and so it's just a cute little educational tool. Yes, sir.
You take your program out on the road. I work with a senior center, and obviously that's a place where there might be strokes. Do you take that to those folks?
Depends on what the road means. If it's semi-close, absolutely. We want to do that. And so, yes, to answer your question quickly, yes. I'd love to talk to you more about that. Yes, sir.
Like I was telling you before the meeting started, I had my own experience, and early in the slideshow was one of the types of stroke called a TIA. Mm-hmm. I had one of those 2 years ago. In this hand, I'm dealing with tendonitis here, so that's why I'm wrapped. But I had just, my routine in the morning, I'd pour a cup of coffee, sit in front of the laptop and read the newspaper. So in the time it took me to pour my cup of coffee, carry it with this hand, set it down, and grab the mouse, I couldn't manipulate the mouse. And that's about the time Gail walked in the room, and I was telling her, he said, well, we're going to ER. And they diagnosed it as there was a vascular surgeon on duty, and he was even in the hospital. And so he was right on top of it, and then
That's awesome.
while I was there, they said it was a TIA.
Well, and just so you know,
Blood thinner. So that was the treatment.
yeah, I have my own opinions about some of that, but however, let me just say this to you. TIA is typically a precursor. So you need to pay close attention. You need to stay going to the doctor because we see a lot of people who have a TIA and then a couple months later they have a full-blown stroke. So just please pay close attention to that. Any other questions?
Just a comment is, I had a very close friend who 3 or 4 months ago had a stroke. He saw all the signs, the next doctor. He knows all the signs. He called 911 right away. And this is where Tom and the folks in the fire department said those guys came right away, and their actions really saved him from having a more serious issue.
Absolutely.
And so don't be afraid to call those guys and come out, and they'll have a better idea of what's really going on with you than you might have when you're
Awesome.
babbling along to yourself or whatever it is.
I was 48, so I mean, you know, you don't know, right? And so, yeah, thank you.
I was just gonna ask if there's any truth to like having an aspirin a day or something like that.
You're going to call me out on that a little bit because of what I said. Frankly, I don't agree with that. This is just my opinion. I'm not a doctor. The doctors know. But personally, it depends on your medical situation. That's how I would see it. If you need it if you have high blood pressure or there's so many things out there, and I don't necessarily agree with the aspirin a day thought. That's my opinion. I hope that helps you do some research on it.
Along that line, that vein, my doctor I've seen for 20 years now does not suggest taking baby aspirin. But when I had this TIA, they immediately gave me some, but for only a month. By then, the Eliquis was kicking in.
Okay, do you have high blood pressure? Did you?
A little bit high, not
Okay.
dangerously high.
Well, they know what they're doing. I don't, and so, but I've been around a while in this realm of what we're going through, and so I feel fairly confident in what I say about it too. So, anyway, doesn't make any sense.
Yes, sir. So one of the symptoms of sleep apnea, you hear people talk about it a lot, is a symptom of stroke. Both of my parents were terrible snorers. Never got any treatment. And indeed those real loud gasping snores, are those mini strokes or are they just symptoms of something that could lead to a stroke? Okay,
so first of all, I'm not a doctor, but I would say, to answer that they could be something that leads to a stroke. They are not a small stroke or a TIA.
It contributes to a lack of oxygen.
Absolutely, and there you go. Right, and that could lead to it, but I wouldn't say that. I would definitely, look at some of the things that are out there to help them breathe better as they're sleeping.
Yeah. So, just to follow up, our genetics contribute or lead someone to think I'm more likely susceptible?
So that's a great question. That was a good question, for sure. Not that they weren't all. I have a thing called HHT, and it stands for hereditary hemorrhagic telangiectasia. And so that is how I got my stroke. And so there are different things that people can have. No one even knew about that in my family until I had my stroke. And now about half of the people in my line of family have it. And they have to go to the hospital, or they have to go have surgery to fix it. And what it is your veins don't connect properly. And so I don't know if I'm answering your question or not, but you know, we all need to pay attention to what's going on out there, and to the doctor. And the doctors don't know everything, nor should they. And I'm not blaming any doctors, but you know, they've got their own realm of what they do, right? And even after a stroke, if you have a stroke, it's like, there you go, you know, go on out, and because we got you better. That's where we come in. That's where Stroke Awareness Oregon or Strength After Stroke comes in to help, because people need help afterwards. I'm sorry, I'm kind of going on my, you know, but I hope that helps.
So if we've got a minute, I'll ask one more question. The genetic testing that you hear people talk about that can identify genes that say you're more prone to a certain medical situation, is stroke within the realm of the genetic testing? Can they?
I don't know the answer to that. I don't know the answer to that. I would just assume that if it was something that was messing with your blood flow or whatever, then yeah, you could be susceptible. But I don't really have an answer for you.
I acknowledge the reference to Rotary, but how otherwise are you supported?
So we get, Strength After Stroke isn't. I am a for-profit company. SAO, Stroke Awareness Oregon, is a nonprofit. And so I would love to let you guys know about some of the, you know, we love to have any and all donations are very well accepted. We get donations from, docs, people who've had strokes. We've gotten some very good donations from people who are fairly wealthy that stroke is in their family, and that helps. So really it's donations is what we're doing right now, and just to keep going. It's been tough, so yeah. Nope.
Thank you very much.
Thank you guys so much. I appreciate it. Oh.
We love to take pictures.
Okay.
Done with the camera?
Thank you. Yeah, appreciate it. Okay.
Okay.
Thank you.
Thank you. Thank you so much. Thank you guys, everybody. Appreciate you guys, really, very much.